Hey everybody, Dr. Dane, Donohue, and I'd like to invite you into our evaluation room. And tomorrow I'm really excited to be doing a webinar with Dr. Jack Wolfson, the paleocardiologist. And a lot of what we do in our practice is to attract people who are really looking for alternative solutions to their healthcare challenges. And I would dare say drug-free solutions to their healthcare challenges and their crisis. And a lot of what we do educationally in our practice and what we're going to be talking about tomorrow in the webinar is what I call the connect, discover, respond model of care. So we connect in the consultation by listening to people. What are their wants? What are their needs? What are their known symptomatic challenges? And what are some of the unknown, what I call ticking time bombs that may be under the surface that they don't know that are taking place physiologically? And we do this by doing a really good evaluation, looking at their lab work, looking at their films, finding out what's going on physiologically with them. And we do a lot of education in our practice, and we use this chart a lot. So in Connect, Discover, Respond, I educate patients that there is a continuum between optimal health. To me, optimal health is 100% function, where the body is functioning at 100%. And it's not so much with our patients trying to get rid of something, it's trying to remove something that's interfering with optimal function and expression in the body. So we're not trying to get rid of their symptomatic problem, we're trying to remove the obstacle that's preventing them from being well. We'll talk about this, but we say there's a continuum between optimal health, 100% function, and the way we're finding most people, and Dr. Jack will talk about this tomorrow, but most people are taking multiple medications. Their health is starting to affect the quality of their life. Their potential has become limited as they get older in what they can do and how they can express themselves in the world. And then finally, their body has limited function. And so most people we find are moving towards this direction and not towards optimum 100% function, continuous development, a wellness-based lifestyle. But I tell them where they are on this continuum has everything to do with these bottom three boxes. Their physical stress. So are they exercising? Do they have good posture and alignment? Okay? Have they had trauma to the body? Their mental emotional stress, the worry, fear, guilt that they have around relationships, the stress they have around finances, the stress they have around job satisfaction, and all the thoughts they have that affect their emotions and affect their nervous system adversely and create a negative physiology. And then finally, of course, Dr. Jack will talk a lot about this. He talks a lot about this in his post to the paleocardiologist, but the toxicity that we're expressing or we're being exposed to through the foods that we're eating, through the chemicals in our environment and the toxins in our environment. And so we'll talk about this continuum, but this is something I use with every patient, and patients get it. They understand that how they feel, how they function is the direct result of how they're living their life. So come join us tomorrow on the webinar. It'll actually be at 11 a.m. Eastern Standard Time. That's 8 a.m. on the West Coast. Join Dr. Jack and I will be talking for an hour. I'll be actually talking to Dr. Jack about how he does his evaluations with his patients. So we'll be talking about his model. How does he connect? What discovery process does he use with patients in terms of evaluating and doing the proper exam? And then finally, how does he respond? How does he respond more in a holistic way where he's not throwing medications and procedures at problems, right? But he's using a drug-free approach to get really great results with his patients. So I hope you join us for this webinar. I think you'll get a lot out of it.